You've probably noticed it. More trips to the bathroom at night. You get tired earlier than you used to. Your ankles feel a little puffy by evening. You figured it was just getting older. And honestly, some of it is. But here's what doctors are seeing right now. In thousands of people your age, these small changes aren't always just aging. Sometimes they're the first whispers that your kidneys are working harder than they should be. Your kidneys are small, bean-shaped organs that most of us never think about until something goes wrong, but they're doing something remarkable right now, filtering your blood, managing your water balance, controlling your blood pressure, and making the hormones that help your bones stay strong. And they're probably aging faster than you realize. The question isn't whether your kidneys change with age. They do, in everyone. The question is whether you catch it early. Here's what I want you to understand first. Noticing these signs doesn't mean you have kidney disease. It means you're paying attention. And paying attention, when it comes to your kidneys, is everything. Kidney function naturally declines with age, on average, about 1% per year after age 30. That's not a failure, that's how bodies work. People catch kidney decline early and live full, active lives for decades. But they have to know what to look for. I'm going to walk you through 10 signs that something might be shifting. Some will feel familiar. Some might surprise you. By the end, you'll know exactly when you should bring this to your doctor, and you'll understand why each one matters. This is about you having the information, not living in fear. Sign 1. You're getting more tired than you should. Fatigue is the most overlooked early sign of kidney decline. And it's also the easiest to dismiss. Your kidneys produce a hormone called erythropoietin. But here's what's actually happening. Your kidneys produce a hormone called erythropoietin. This hormone tells your bone marrow to make red blood cells. Red blood cells carry oxygen throughout your body. When your kidneys age and become less efficient, they produce less EPO. Fewer red blood cells means your blood carries less oxygen. Your muscles, your brain, your heart, they're all running on a slightly lower oxygen supply. That exhaustion you feel isn't laziness or depression or age catching up. It's your cells signaling that they need more oxygen. This fatigue often hits hardest in the afternoon. You start strong in the morning. Then by 2 or 3 o'clock, you're running on fumes. You might need an extra coffee. You might skip a walk you'd normally take. Some people describe it as dragging through the day, that heaviness that no amount of sleep seems to fix. Almost nobody realizes this could be a kidney signal. Sign 2. Your bathroom habits have shifted. This is a big one, and it's usually the sign that finally makes people wonder if something's different. Maybe you're getting up to urinate more at night, 2, 3, 4 times instead of 0 or 1. Or maybe you've noticed the opposite. You're urinating less frequently during the day. Some days your urine looks darker or has a slight foam to it. Here's the mechanism. Your kidneys filter waste and excess water from your blood to make urine. When kidney function declines, they struggle to concentrate urine properly. You might need to go more often because the urine is more dilute. Your body is telling you to get rid of more fluid to remove the same amount of waste. Or, in the other direction, your kidneys might retain fluid longer, so you go less frequently but in larger amounts. The color change happens because waste isn't being diluted as effectively. Night urination is particularly noticeable because it disrupts sleep. You're getting up once or twice in the middle of the night, groggily shuffling to the bathroom, never quite falling back into deep sleep. And you wake up feeling less rested. Most people blame sleep apnea or just getting older, and yes, those are real. But abnormal nighttime urination can absolutely be an early kidney signal. Sign 3. You've noticed puffiness, especially around your ankles and eyes. This one is subtle but visible. You take off your socks and there's an indentation around your ankles. Your watch leaves a deeper mark than it used to. Or you notice your face looks a bit rounder, especially around the eyes, in the morning. This is fluid retention. Your kidneys regulate electrolytes, sodium, potassium, phosphorus, which control how much fluid your body holds onto. When kidney function declines, this balance shifts, your body saying. The puffiness is usually worst in the morning or after you've been sitting for a while. It improves somewhat when you move around or lie down, because gravity helps redistribute the fluid. But it doesn't fully go away, and it's worse than it used to be. These first 3 signs are the subtle ones. Easy to miss, easy to rationalize. But here's what researchers found next that changed how doctors approach kidney screening. When they checked people who reported these 3 symptoms together, they found kidney function was already declining in about 40% of them. Sign 4. Your blood pressure has crept up. and it's harder to control. This one has a two-way relationship with your kidneys, which is why it matters so much. Your kidneys produce hormones and regulate sodium, both of which control blood pressure. When your kidneys age, they become less efficient at managing these two things, so your blood pressure starts creeping up. But here's the feedback loop. High blood pressure also damages kidneys. It's a vicious cycle. The higher your blood pressure, the harder your kidneys have to work, which makes them age faster, which makes blood pressure management harder. People often notice their blood pressure reading is unexpectedly high at a doctor's visit. Maybe it's been staying around 140 or 150 over 90 or higher when it used to hold steady at 130 over 85. Or it's become unpredictable. Some days controlled, some days elevated. If you're already on blood pressure medication, you might notice you need a higher dose, or a second medication gets added. If you've never had high blood pressure before, seeing elevated readings is jarring. Most people don't connect this to kidney aging. They assume it's just another sign of getting older, which is partly true, but kidney decline is absolutely part of the picture. Sign 5, you're craving foods less, or you've noticed a metallic taste. This is a weird one, and it throws people off. You sit down to eat something you normally love, and it just doesn't appeal to you, or you notice a slight metallic taste in your mouth that won't go away. You brush your teeth more often, use mouthwash, but it lingers. Here's what's happening. When your kidneys can't filter your blood as effectively, waste products build up. One of these waste products is called uremia, a buildup of urea and other nitrogen-containing compounds in your blood. Your taste buds are sensitive to these compounds, so they start tasting bitter or metallic. Your appetite diminishes because your body is signaling. People sometimes think they're getting full faster, but really it's that food is less appetizing. For some, this leads to unintentional weight loss over a few weeks or months. For others, it's subtle enough that they just eat a bit less without really noticing. Sign 6. You're having difficulty concentrating, or you feel brain fog. This is frustrating because people often blame stress, age, or poor sleep, and those things matter too. But if you're experiencing unexpected brain fog, the cause might be partly your kidneys. Remember that uremic buildup we just talked about. Some of those waste products affect your central nervous system. Your ability to focus becomes fuzzy. You lose your train of thought mid-sentence. You read a paragraph and realize you didn't absorb a word. Some people describe it as mild confusion or feeling slightly off. This is separate from normal age-related cognitive changes. It's more acute, something you've noticed shifting over the past few weeks or months. You might also feel apathetic. Normally engaging activities feel uninteresting. It's not depression exactly, though it can feel like it. It's more like your brain is running slightly out of sync. Sign 7. You've developed persistent high blood pressure despite treatment, or you have pain in your back or flank. Let's address the blood pressure piece first. We touched on this in sign 4, but here's the escalation. You're now on medication, maybe even 2 medications, and your blood pressure still isn't where it should be. You're following the diet, you're moving, you're taking the pills, and still, your readings are frustratingly high. This is a sign your kidneys might be the primary driver of your high blood pressure, not just a consequence of it. Sometimes medications need to be adjusted specifically to target kidney-related blood pressure elevation. Now, back or flank pain, pain on either side of your lower back, just below the ribs, can have many causes, but when combined with other kidney-related signs, it's worth noting. Your kidneys sit in the retroperitoneal space, tucked against the back of your abdominal wall. When there's inflammation or if there's an underlying kidney condition accelerating aging, some people feel a dull ache or pressure sensation in this area. It's not sharp or debilitating usually. It's a low-level discomfort that's been there for weeks or months. At this point in our list, we're moving from subtle whispers to things worth mentioning to your doctor soon. The first 3 signs might have felt dismissible. Signs 4 through 7 are noticeable enough that something in your body is clearly shifting. Before we finish the last 3 signs, you need to understand the why underneath all of this. Because understanding the mechanism makes you less likely to panic and more likely to act. Your kidneys are built on tiny filters called nephrons. You have about 1 million of them in each kidney. Each nephron is a microscopic blood vessel wrapped around a collecting tube. Blood flows through the capillary, waste and excess water filter out into the tube, and clean blood returns to circulation. It's elegant and relentless. Over time, several things happen. The capillaries lose some of their elasticity, the filtering membranes thicken, Some studies suggest that by age 70, about 30 to 40% of your nephrons are no longer working at full capacity. This isn't a disease, it's the natural consequence of the kidney being a filter exposed to 40, 50, 60 years of constant wear. Add in even mild high blood pressure, diabetes, or certain medications over the years, and the aging accelerates. The second piece is hormonal. Your kidneys produce that EPO we mentioned, which controls red blood cells. They also produce a hormone called calcitriol, which helps your body absorb calcium. As kidneys age, production of both decreases. That's why older adults with declining kidney function often develop anemia and weaker bones. And your kidneys also regulate acid-base balance in your blood. A younger kidney is very efficient at managing slight imbalances. An aging kidney is slower. Your blood can become slightly more acidic over time. This might not sound dramatic, but chronic mild acidosis contributes to muscle weakness, bone loss, and even mental fog. The third piece is waste accumulation. Your kidneys aren't failing, they're just slower. So substances like creatinine, urea, and phosphorus build up gradually in your blood, instead of being cleared immediately. At mild levels, this doesn't cause symptoms. But as accumulation, here's the empowering part. Catching this process early and slowing it down is absolutely possible. Control your blood pressure, manage your blood sugar if you're diabetic, stay hydrated, avoid nephrotoxic substances like excessive NSAIDs or certain supplements. Some people benefit from medication that specifically protects kidney function. Regular monitoring through a simple blood test tells your doctor how quickly your kidney function is declining. Most people who catch decline early and follow their doctor's plan never reach the point where dialysis is necessary. 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 Never reach the point where their quality of life is dramatically affected. They simply may. Sign 8. You have muscle cramps or weakness, especially in your legs. As waste builds up and your kidneys struggle to manage electrolytes like potassium and calcium, your muscles suffer. You might experience unexplained cramping in your legs, especially at night. These aren't the cramps you get from running hard or dehydration. They're persistent, recurrent, sometimes painful enough to jolt you awake. Some people describe a general heaviness or weakness in their legs. Climbing stairs feels harder than it should. Your grip strength might feel less powerful. This is partly the anemia, low red blood cells, low oxygen, and partly the electrolyte imbalance and uremia affecting muscle function directly. Sign 9. You're experiencing shortness of breath, particularly during mild activity. This one worries people, and rightfully so. It demands attention. You might feel breathless after a short walk, climbing stairs, or even light activity that never used to bother you. You're not necessarily gasping, but you feel like you're working harder to breathe. There are two mechanisms here. The first is anemia. Fewer red blood cells means your body is working harder to oxygenate your tissues, so you breathe faster to compensate. The second is fluid accumulate in the lungs or around the heart. This is a more serious sign and definitely warrants urgent evaluation. Sign 10. You have nausea, vomiting, or a pronounced loss of appetite. This is the sign that usually propels people to finally make an appointment. They might have dismissed or adapted to the earlier signs, but waking up nauseated or feeling actively sick is different. The uremia buildup is significant enough to trigger your nausea centers. Your appetite is gone, not just diminished, but genuinely gone. Food is unappealing. It might be the moment everything clicks into place. Oh, that's why I've felt off for the past few months. Here's what I want to leave you with. Kidney aging is universal, but early detection is not. The difference between someone who develops kidney disease that impacts their life and someone who catches decline early and manages it successfully, often it's just awareness, knowing what to look for, being willing to bring these symptoms to your doctor, even when they feel minor or ambiguous. If you recognize yourself in 3 or more of these 10 signs, especially if they've developed over recent months, schedule a checkup. A simple blood test measuring creatinine and GFR, glomerular filtration rate, is all your doctor needs to see if your kidneys are aging faster than they should. There's no pain, no invasiveness, just information. And here's the really important part. If your doctor does find your kidney function is declining, it doesn't mean you're in crisis. It means you have the information to make smart choices right now. Manage blood pressure, lower sodium intake, stay hydrated, move your body, avoid unnecessary NSAIDs. Some medications specifically protect kidney function. Your doctor will tell you if one's right for you. People live full, vibrant lives managing age-related kidney decline. Because you don't have to feel sluggish, achy, brain foggy, or worried about what your body's trying to tell you. You can get answers, you can take action, and you can prevent a slow decline from becoming a serious problem. If this video resonated with you or helped clarify what you've been experiencing, please drop a comment below. Let me know which of these signs you've noticed or if you have questions about kidney health. And please, subscribe if you found this helpful. I'm making videos like this regularly to help you understand what your body's telling you. Your kidneys have been working for you your whole life. It's worth paying attention to them. Thank you for watching. Most